I'm Lisa Fletcher for Spotlight on America. The FDA commissioner says it's time to put babies ahead of big business and reverse decades of innocent until proven guilty thinking about what's in their food. Now, we have new test results about what's still lurking in infant formula and why the new commissioner says the rules are about to change. For decades, the FDA has let baby formula makers essentially police themselves. A system that's left toxins and contaminants hiding in plain sight. Hey, Commissioner, good to see you. We sat down with the agency's new commissioner, Dr. Marty McCary, who says that era is over.
We're going to go from a standard of basically innocent until proven guilty to the opposite, and that is you have to prove to us that it's safe for kids.
That's very European of you.
It's already accepted in Europe, and it's something that we should be doing.
A radical shift for the Food and Drug Administration, one that could upend how infant formula is made and approved in America.
Gandhi once said the best measure of a society is how it treats its most vulnerable members. No one is more helpless in society than a newborn baby.
America's seen what happens when that system fails. Tragic infant deaths from contamination, a nationwide formula shortage, and now new test results showing toxic chemicals still slipping through. We obtained exclusive new infant formula lab data from the Clean Label Project, a nonprofit that tests and certifies consumer products. It found heavy metals dropped significantly since 2021, but they aren't gone.
We're asking the companies to reduce the number of heavy metals because it's too high in many instances. The right number of heavy metals in baby formula is 0.
Newer, smaller companies performed better, some showing 0 heavy metals are possible. But a bigger surprise came from the lab. For the first time, tests detected DEHP in infant formula, a toxic plasticizer that can leach from packaging, found in nearly 95% of legacy formulas tested, with the highest levels 6 times higher than newer brands. Studies link DEHP to cancer, developmental delays, and neurological effects, so severe that Congress banned it from children's toys in 2008.
We desperately need to innovate in this space.
This summer, McCary gathered manufacturers to meet with scientists whose warnings directly reflected what the new tests found.
Not only the heavy metals, but things such as phthalates from the plasticizers, perfluorinated compounds, and one of the big emerging areas, microplastics and nanoplastics. I think all of these things need to be part of the safety considerations.
For years, the FDA's approach to contaminants has been piecemeal, contaminant by contaminant. Would you like to see a larger regulatory framework that broadly encompasses baby foods and infant formulas, so when parents go shopping, they feel secure that these are actually safe products that don't contain toxins?
Yes, we have got to start talking about food as medicine, the microbiome, environmental exposures, the root causes of our problems, and there should be no sacred cows. There are no corporate or lobbying interests that we're tiptoeing around, but there's a lot of work that needs to be done.
This year, 3 Republican senators introduced bills to ban all heavy metals in infant formula. We're going to keep a close eye on that. Now, for more information on the infant formula testing data and to see the brands tested, go to SpotlightInvestigates.com. For Spotlight on America, I'm Lisa Fletcher.